This is Global Health TV, our monthly show exploring ways to improve health, increase equity and protect against global threats. Today we're focusing on maternal and newborn health. We visit Zibo City in China to see no-pain labour and delivery global health initiatives, collaborations with Chinese hospitals to improve outcomes for mother and babies. But first I'm joined by Emilia, Guasch, Arvelo and Ruth, Landau-Cahana to discuss the health impact on women giving birth during COVID-19 and the lessons learned by those caring for them. Thank you very much indeed for joining us today. Emilia, could I start with you? Could you tell us a little bit about what the impact has been on women giving birth from COVID-19?
It's been a real challenge in terms of access to healthcare services, especially in low and middle income countries, because not only of the access to healthcare for women, it's also the healthcare services for healthcare workers, the PPE, and what it had to happen, because we knew nothing about cesarean delivery rates, general anesthesia rates, and all what it's related to analgesia and anesthesia in pregnancy.
What solutions to these huge challenges have you been able to find?
We have to invest much more in healthcare promotion and in terms of equity, in equity access to healthcare services, because it has COVID crisis has demonstrated the lack of equity in access to healthcare, especially for women.
Now, how critical is it that pregnant women can access vaccines?
It's absolutely critical. They should have the universal access to vaccines, even more in low and middle income countries and in our high income countries. The pregnant women rate of vaccination is lower than non-pregnant population, and in low and middle income countries is very, very low.
Ruth, you and your colleagues have been on the front line of COVID-19. And what have your experiences been of caring while learning?
We started hearing about COVID in February, early March, and preparing to manage patients that would show up in our unit. But as much as we thought that we were prepared, nothing really prepared us until we had our first patient. Actually, on the first night, we had 2 cases which had been tested, and we knew that their PCR was positive, and both of them needed a cesarean delivery. I would say that the most important thing was to prepare to provide safe care for potentially very sick women while keeping everyone else safe on the unit. We didn't want to contaminate other patients, and obviously we didn't want to contaminate ourselves, the staff, and also our families when going back home after a busy shift. So I think the notion of safety, where usually anesthesiologists excel at, just got another level of complexity, and keeping everyone safe while at the same time providing the best experience possible. We didn't want our women to feel that we weren't caring for them or that we were providing subpar management.
What would make a difference now? Women are still presenting with COVID-19 and pregnancy. What would you like to see happen next?
Well, Emilia mentioned it. Vaccination is key. The vaccination rate overall in New York City is quite high, and we're very happy about this, but it lags behind in pregnancy. So we don't have a vaccination rate that is sufficiently high or as high as we would like it to be. And we know it is essential for outcomes in pregnancy and for everyone around. So I would say enforcing or ensuring or promoting vaccination in pregnant women continues to be key. And for the management, we haven't seen particularly sick patients. And I think that that's also a problem because our vigilance sometimes tends to fatigue. I think that we're in it for a while, so I really hope people don't fatigue too much.
Thank you both so much indeed for your insights and for joining us. Now, No Pain Labour and Delivery Global Health Initiative's International Medical Education Programme has improved mother and baby's outcomes and is reproducible in multiple hospitals in China. The programme includes the initiation of 24/7 anaesthesia coverage in labour and delivery suites in a systematic approach and an initial step for bundle cares in order to prevent or reduce maternal and infant morbidity and mortality. We went to Zibo City in China to find out more.
然后打完无痛就感觉太舒服了，打完之后我立马感觉不到痛了。昨天晚上疼了一晚上，我都快要放弃了。无痛分娩对于妈妈来说真的是一项伟大的发明。
所以我觉得打无痛是非常非常有助于顺产的，因为你意识很清晰，你知道怎么用力了，也能够完全配合医护人员的指导和教你怎么使劲儿。
反正生的过程也不是很痛苦，就是一点点嘛，就是也能感觉到疼，但是有无痛嘛，然后不是那么的疼，感觉无痛还是。
2016年，无痛分娩中国行的专家团队第一次进入我们医院，通过培训和演练，规范了无痛分娩和5分钟即可剖宫产的流程，进一步保障了产科麻醉和产房的安全。2018年呢，我们医院无痛分娩呢，开展了2189例，无痛分娩总量位居全市的第1位。2019年呢，我们被国家卫健委列为全国第1批无痛分娩的试点医院，并在国内首家开启了宝贝第1计划的行动。
We actually got very positive results from collaborating hospital, which is about 108 hospitals. Among those hospitals, 19 of them achieved the modern labor and delivery suites. 21 of them received the second level of training, and then 68 of them got the first level.
医院各科室团队合作意识和业务能力也得到了全面的提升，产妇呢满意度大幅的提高，并吸引了周边区县的产妇来我们医院进行分娩。我们的年分娩量从原来的每年3800例上升到现在高峰时期的6800例。急症剖宫产从决策到胎儿娩出，手术的时间呢也大大的缩短，剖宫产率从最高的47%下降到了现在的38%。
最早的时候，我们产科这个遇到特殊的情况呢，基本上是我们产科自己以后来孤军奋战。现在呢，通过无痛分娩中国行在我医院普及以来呢，现在作为一个多学科团队来协作，明显的减轻了我个人这个身上的担子就我们就是说，作为无痛分娩中国行在我们医院实施以来呢，就是说确保了就是孕产妇的安全和降低了新生儿这个窒息率。
就说通过这几年的努力呢，我们的无痛分娩这个率从2016年的22%上升到现在的90%以上。这当然与我们医院的领导和我们多学科的合作这是分不开的。这几年呢，通过无痛分娩中国行的指导和交流，我们已经熟练地将5分钟即可剖宫产运用到我们的产科急诊手术中。每周呢，我们会在产房的手术间进行2至3例这样的急症剖宫产，然后让每一位员工呢都能够参与到这个急症剖宫产术中来让他们都熟练地掌握这些流程。
比较落后于西方发达国家，就是他给我们传输了一些新的理念包括对孕妇疼痛的重视程度包括对孕产妇的安全的重视，包括对新生儿安全的重视，都让我们有了很大的进步这是对我们这种提高我们的产科质量保证母亲跟婴儿的健康提供了很大的帮助。
无痛分娩还有现在产房建设，使我们的整个的分娩过程不再是产科孤军奋战，而是由麻醉科、新生儿科多学科共同配合，也为我们产科的急症的处理，比如脐带脱垂、胎盘早剥、胎儿窘迫，提供了有力的保障，保证了母婴安全。
这样疫情之后呢，不方便现场交流， 胡教授就开启了现代产房学堂2.0的课程，也是多个专业进行共同的讨论，然后课堂内容呢十分丰富，实用性特别强。
We do have a hybrid webinar once a month. We have 25 hospitals and multidisciplinary, including obstetricians, anesthesiologists, neonatologists, and midwife, and healthcare administrators, and they working together. We have one common topic a day. Sometimes we have a hard time to stop and running because the people have lots of questions. Their maternal and fetal outcomes get dramatically improved. What we see is cesarean delivery rate decreased. We see forceps rate decreased. We see, interestingly, blood usage was decreased. We see all the baby data get better.
Care bundles have been rolled out in the United States in the past couple of decades. We have also helped our Chinese colleagues roll out the care bundles. It's an example of how everybody works together to take care of the pregnant patient, and we all do it systematically. We do it the same way every time, and this improves safety and the care of the women that we're taking care of. We've learned a lot by working with our Chinese colleagues, and I think now our Chinese colleagues can help us spread this program to other parts of the world where maternal care is not as safe as it is in China and the United States.
That's it for today's show. Be sure to check out some of our recent videos, including a handheld device to detect breast cancer, human rights and population-based science with Johns Hopkins, as well as 3 special reports about the comprehensive UK COVID study Imperial React. Join us again next month for more news and views from the global health community. Until then, until 2022, it's goodbye.